Welcome, everyone. My name is Thomas Hale. I'm an associate professor at the Blavatnik School of Government, and this is a webinar looking at what we have learned from tracking every COVID-19 policy for the past 2 years from the Oxford COVID-19 Government Response Tracker, of which I am the academic lead. I'd like to start, though, by telling you a story that began 2 years ago. You'll remember, thinking back to the February and March of 2020, a lot of different governments began to put in place very different kinds of policies in response to a novel coronavirus outbreak. I was at the time teaching a course I teach every year at Oxford on comparative politics and policymaking across the world to our Masters of Public Policy students. And we were looking at different kinds of policies in different countries, and we were realizing that what we were seeing unfold as governments responded to this new threat was really quite different and surprising. And so we'd ask a student from China what was happening in his country. We'd ask a student from Nigeria what's happening in her country. And we realized we were creating with this kind of discussion in the class, drawing on the very diverse international student body, a really important resource, which was comparable information on what governments were doing and what they weren't doing on a whole different range of responses to COVID-19. And so we thought, actually, this is something we should take beyond the classroom. And in a few weeks, we put together something that became the Oxford COVID-19 Government Response Tracker, which launched 2 years ago today. And this is what we'd like to do today, to share you a bit of information of what we found since then, looking at this resource. So our agenda is to say a few words about the project, to talk a little bit about what we have learned, and to say a few things about what we can expect next. And we're going to be hearing throughout the next 45 minutes or so from many members of the Oxford COVID-19 Government Response team, who we'll introduce as we go through. But we'll also be looking forward to your questions and comments. So please do look at the question and answer box you have down on the screen, and type in your thoughts and questions as they arise. And we'll try to address those as we get toward the end of the time together. So let me jump to the next slide and say a few words about the project. The Oxford COVID-19 Government Response Tracker is a way of recording comparable information about different kinds of policy measures governments have taken in response to COVID-19. It's a data set that is publicly available, updated continuously, and it covers a whole swath of different measures in response to COVID-19. It covers currently over 185 countries, 200 different subnational jurisdictions from the 1st of January 2020 to the present. It includes information on different kinds of policies, including closure and containment policies, so-called lockdown policies, if you will, health policies, economic policies, and over the last year, really, vaccination policies, as they've become an important part of countries' defenses against COVID-19. It's a project that's powered by a huge network of volunteers, which we'll say more about in a moment. 1,200 people have contributed their time and energies to recording this information. They speak over 100 languages, and they really are the engine that drives this project forward. This information helps us serve three primary audiences. We're able to give researchers information about how different government behavior has evolved so that they can analyze the impact of policies on the spread of the disease, or perhaps on the economy or on mental health or other outcomes of interest. They can use this information can also help governments and policymakers understand who's doing what responses they're doing, how do those compare to other kinds of countries, again, to help them improve and calibrate their responses over time. And third, a huge audience for us is, of course, the public, the media, the people who are trying to think about how this incredible crisis the world has been through it plays out, and what you can say about who's done what and who hasn't done what. So it's been a very intense 2 years to put together this information in a comparable way, but it's already yielded a huge number of insights that are helping researchers, governments, and publics respond to this threat in real time, and also setting up conditions for us to improve our responses going forward. So let's get into then some of the lessons we've learned from tracking nearly every COVID-19 policy of the past 2 years. And to do that, I'll turn to my colleague and co-principal investigator, Dr. Anna Petherick, who is a departmental lecturer at the Blavatnik School. Anna, over to you, please.
Thank you very much indeed, Tom. So as Tom was saying, if you go back to those long ago days of March 2020, which do seem a long time ago now, what this chart shows, and this chart shows all of the policies around the world, we saw an initial ramp up of policies, all of the different types of policies pretty much all at the same time, and almost everywhere around the world. So this chart shows the percentage of countries with required policies of lots of different types and how those percentages changed over time. And I wanted to draw your attention to a few things. So first of all, after that initial bold ramp up, we saw more variation across countries, but also within them in terms of which policies they kept in place. And there are two particular policies of interest, and you'll see one of the lines on the chart sort of starting very low and then zooming all the way up. And those are our facial covering policies. And these became more common over time, and Toby's going to talk about them later. The other line, which I think is quite interesting, is the green line, and this is generally the lowest one on this chart. And these are the stay-at-home policies. And these are, if you like, the most taxing policies for citizens to observe. It's not nice to not see your friends and have to just literally sit in your living room and work from home like that. So what we've seen is these tend to be the policies that are first to be lifted when governments are releasing high stringency. If we go to the next chart, this chart is a bit more complicated. It's beautiful. And what it does is it illustrates if you like, a way of generalizing different strategies that countries have pursued. Now, over the course of the pandemic, for most of it, we could really divide the world into the mitigators and the eliminators. So the mitigators would be the countries that really sought to flatten the curve. If you like, the countries that sort of assumed that community transmission would be a reality, but they tried to control it, to manage it. And then countries, for much of the pandemic, although obviously this is getting harder, tried to eliminate it as well. So whenever there was a possibility that community transmission might emerge, they really tried to clamp down. Now, this chart shows the willingness of countries to bring in their second stay-at-home order compared to their first. So the y-axis is the case rate when countries implemented stay-at-home orders, and all the countries are dots that move. So they start off in the middle, and that's the point where they first implemented stay-at-home orders. And you'll see that the countries in red, these are our mitigators, trend up on this chart, meaning that the case rate was higher the second time that they introduced this toughest of policies. And the countries in blue are our eliminators. For these countries, the case rate was lower the second time that they introduced the stay-at-home requirements. So if you like, it's a story of sensitivity. The mitigators became less ready to restrict their citizens over time, and the eliminators became more ready to jump and impose these toughest of policies. If we could go to the next slide, please. So that I just showed you so far was really an example of what the policy data on its own can show. But of course, we can show even more fascinating patterns when we combine the policy data with other forms of data. And here, in this slide and the next, we've combined it with behavioural data. Now, in these charts, we have a dotted line going across the middle, and we have time across the bottom, the x-axis. Now, what the dotted line shows is our baseline level of behavioural observance of different protective behaviours. This is how much people of many different countries observed these behaviours in the first month that the policies were introduced. And the chart on the left shows avoidance of gatherings and going out. So if you like, the similarly tough policies to staying at home, the idea that you have to just be a little bored and really restrict yourself. And the chart on the right shows observance of mask wearing. Now you'll see the chart on the left, you see a downward trend. So after that first month, illustrated with the dotted line, you see that people tend to observe these tough policies, the physical restrictions on going out, less and less, to a point where they reach a kind of plateau or threshold. And this is being discussed in various ways as a kind of behavioural fatigue. And then the chart on the right, and the controlling for the strength of policy, shows that people have become more willing, if you like, to wear masks. Now, this is actually a really interesting combination of charts theoretically, because it suggests a kind of logic behind the scenes in people's heads. If people were mainly trying to reduce the risk to themselves, they would do everything they could to protect themselves as much as possible. And you would see the same patterns for different kinds of policies. Instead, what we see is that for the arduous behaviours that become tougher with each day that passes, people tend to do them a bit less over time. They struggle. But for the ones that are more habituating, like mask wearing, which might be a bit like wearing a seatbelt, if you like, people find it easier to do over time. So if you like, there's a behavioural science explanation, we think, for what's going on. And if we could go to the next slide, please. So we can take this logic forward by actually comparing different countries. And what we've done here is we've divided up the world into two halves. So the countries with high trust in institutions and low trust in institutions, and that's the chart on the left. And the countries with high trust in strangers or interpersonal trust and low trust in strangers, the chart on the right. And if you just take a step back and just look at the main pattern here. So it's only in the charts on the right do you see that these dots split over time. And what's going on here is the countries with high interpersonal trust, trust in strangers, they remain closest to their initial baseline level of observance as the months go on. Countries with low trust in strangers tended not to do this. And what we think is going on here is that it's only really worth you observing these difficult policies, trying to reduce the community infection rate, if you believe that other people are also doing that. Otherwise, you're not going to get the outcome that you were hoping for. And so this is fascinating to observe in the data. I'm going to hand over now to Helen, who's our data systems manager.
Thanks very much, Anna. So in addition to non-pharmaceutical interventions that we've been tracking since March 2020, around 6 months ago, we realised that there are also some really important policies regarding vaccination that would be really interesting to track, which is, I think, a great example of reflection of how the OxCGRT project has had to respond quite quickly to the ever-changing policy world that has been the pandemic over the last 2 years. So we decided to track 4 key elements of vaccination policy, and this is what we found. So countries published a prioritization list saying what order they were going to vaccinate people in with limited vaccine supplies. And this was in order to prevent harm to the economy, to reduce the burden of deaths and disease, and so on. And we observed quite a different approach in lots of different places based on who was prioritized when. Most commonly, elderly care residents and staff and healthcare workers came in the top 3 groups that were prioritized. Some countries prioritized 10, 20, 30 groups, some only 4 to 5, and some really focused on frontline workers and people critical to the functioning of the economy, as opposed to those who were at higher clinical risk. We also looked at when vaccines became available and people were also eligible to get a jab in arms. The majority of countries were vaccinating at least one group by April 2021, so just over a year ago. And most places had made access universal, so to all adults over 18 by the end of last year. We looked at the cost of vaccination to different groups, thinking we might observe quite a variety of policies, when actually most places did fully fund vaccination to all of their residents, with the exception of 5 or 6, which required a nominal fee. And then finally, vaccine mandates have become a topic of increasing discussion over the last 6 months. And if you look at this map here, you'll see the 62 countries which have introduced mandatory vaccination for either a group, normally by occupation, or an age group in that country. The most common category being government officials and individual occupational categories, with a handful of mandates being for either the entire population or a large chunk of the adult population. me go to the next slide, please. So alongside vaccination policies regarding people actually becoming vaccinated, we've also observed an increase in differentiated non-pharmaceutical interventions based on vaccination status. So vaccine passports, vaccine passes, apps, and so on, limiting people's access to public life and society based on whether they've been vaccinated or not. So for 10 of our indicators, including school closures, stay-at-home orders, public transport, workplace closures, and public events, we're now collecting the value for non-vaccinated people and the value for vaccinated people, so we can observe what differences vaccinated and non-vaccinated people are experiencing. We found 110 countries have one or more vaccination policy measures in place which restrict access to public life based on vaccine status. And this graph here shows over time how more and more places have introduced some kind of vaccination policy. We've added this data to our GitHub Scratchpad, so it's an experimental CSV which we're still working on. And for 3 of our indices, so the Government Response Index, our very well-known Stringency Index, and our Containment and Health Index, we're using this non-vaccinated and vaccinated data to calculate 4 different versions of these. So users can look at just the vaccinated index, the non-vaccinated index, an average of the 2. And we're also, for our national data set, publishing the index value which is weighted by the proportion of adults who have completed a first initial protocol of vaccination using the data from our World in Data. Next slide, please. Thank you. The indicators that we found use different policies for vaccinated and non-vaccinated people the most are workplace closures. So for example, you may need to show proof of vaccination to enter a shop or a bar, public events as well. I think we'll all know very commonly expect people to prove that they've been vaccinated. Public transport, internal movement, and then less commonly other indicators, notably Austria implemented a stay-at-home order for non-vaccinated people, and international travel too. So you can see that some places there's very little variation, for example, China and Nigeria. And others, there's a huge gap in the stringency for non-vaccinated and vaccinated people. So France and Germany being notable examples who have really made use of strict vaccination passes to limit access to public life for non-vaccinated people in order to reduce transmission and encourage vaccine uptake. So that's just a taster of how we've studied vaccination policies over the last 6 months to a year, and some of our initial findings. And I'll hand over to my colleague Maria to continue. Thank you.
Thank you so much, Helen. So the chart on the left compares the federal and country stringency indexes for Brazil. It shows that much of the policy response to COVID-19 in the country has been initiated by subnational levels of government. And even in those cases where there was a federal policy in place, such as a national law stating a mask mandate or a decree signed by the president listing all the services and activities considered essential, those policies still differ from official statements from the president and the ministers of health, who usually dismissed mask wearing and urged people to not let the economy stop. On the right, we have a chart that shows the stringency index for by indicator at the country level for Brazil. It is worth mentioning that Brazil had one of the longest school closures in the world, and that happened in a scenario with 2 major features worth highlighting. The first one is that Brazil has a universal policy to offer free meals at public schools, and school meals consumption influences food security. meaning school meals are usually the main, if not the only, daily meal children will have. So school closures has been associated with Brazil being back on the World Hunger map. And the second feature is inequality of internet access, both in terms of geographical regions and socioeconomic status. For example, in the north, entire regions depend on satellite connections or mobile 3G and 4G. As in the south, on the other hand, fiber optic internet is widely available. That already separates these two regions when it comes to speed, quality, and stability connections. So that kind of long school closure took place in that socioeconomic scenario. So now I'm gonna hand it over to Hao, who is the China subnational lead. Hao, over to you.
Okay, thanks, Maria. So now let's move on to the situation in China. So with the zero COVID strategy, China suffered 4 waves of epidemic outbreaks in 2021, 3 of which were driven by the Delta variant. So as indicated by the left-hand side figure, the mean stringency index of China's 31 provinces increased rapidly when China suffered Delta variant for the first time last summer. And its peak value exceeded the pre-Delta wave significantly. And in the following Delta waves, China implemented more targeted responses, and the peak value of the stringency index is lower than that in the summer wave. So the figure on the right, the figure on your right-hand side could further illustrate the change of policy responses behind the stringency index. So the dotted line represents the number of provinces with at least a soft version of a given policy, while the solid lines show the number of provinces with a more stringent version of that policy. So as the solid green line shows, most of China's provinces implemented compulsory internal movement restrictions during Delta waves, which means that travelers coming from middle-high risk areas need to show negative PCR tests to enter other cities or provinces. And the adoption of compulsory facial coverings represented by the solid purple line and suggestive stay-at-home orders represented by the dotted red line also increased during the Delta waves. And another significant difference in China's policy response recently is that several cities in China have re-adopted stringent stay-at-home orders to cope with a resurgent Omicron wave. So the solid red line in the right-hand side figure has been increasing since last week, and the value of the overall stringency index is almost the same as that in the first Delta wave. And then we will continue to monitor the development of this Omicron wave closely and see if China's responses could get relieved in the following waves, just like the case last year. So that is the story in China. Now I will leave the floor to Kathleen to introduce the situation in the US. Thank you.
Thanks, Hao. Hello, everyone. My name is Caitlin. I'm the US lead for OxCGRT. So in the US, the policies are enacted at both the federal and the state level. In the pandemic, the majority of responses were recorded by us. We saw them at the state level. They were often enacted by state governors. So in this chart, we wanted to evaluate how responses differed among governors of the 2 predominant political parties in the US. Those parties being the Democratic Party, which is more left on the political scale, and the Republican Party, more right. This chart shows the average stringency of states with Democratic governors in blue and Republican governors in red. And you can, in thinking about average stringency index, this is the good way to think about it is the intensity of the policy response. We can see a marked increase in responses across all states shortly after the WHO declared the pandemic, with an average of the Democratic states reaching a higher peak. Although there is some variation in the gradual decrease in the difference between stringency responses between the Democratic and Republican states, the changes in average stringency levels tend to be similar in magnitude and occur around the same time periods. Can we go to the next chart, please? So I wanted to add some information here. So in adding the average deaths weighted by population, we can get a bit more insight into what happened across states, especially given that Democratic states tend to be more closely and densely populated and have a higher population overall. Although there is a very large difference in that first wave, which occurs April 2020 to about July 2020, a good portion of that occurring in New York, the difference lessens in that second wave despite a maintained gap between the two response lines. Then around July 2021, the red states start to see a greater average death rate despite little change in the stringency index representing that policy response. So finally, the last layer of this, I promise, I added the average percentage of people fully vaccinated from data from Our World in Data, which improves our understanding of what is happening in the US during that July to November death rate there on the right-hand side. Thankfully, in the US, we're actively preparing our US vaccine policy data that will really enhance what we're seeing here and how the US is transitioning into its new normal. Thanks, everyone, and I will hand back to Tom.
Thank you, Caitlin, and thank you, everyone, for giving that tasty menu of snapshots of different insights from the database, both at the national level and the subnational level, looking at the policies themselves and also their impact on behavior or on the spread of the disease. And this is just a small taste of what the whole range of questions people have been asking using these data over the past 2 years. So what I'd like to think about, what I think we're all grappling with now, though, both those of us in the project and people in the wider world, is what can we expect next from this pandemic? Obviously, COVID remains with us. We're seeing in some parts of the world today a sharp rise in cases, many of them attributed to a new version of Omicron. And we know there'll be future variants to come. We know there'll be more of this journey to walk together. But what is beginning to emerge is perhaps a sense of what a new set of longer term strategies might look like. In other words, what a new normal might be. And so as we go forward as a project, we're very interested in tracking and comparing what will that new normal look like? What level of baseline mitigation measures do we expect to remain in place for different countries? And how might that vary across countries? For example, will countries maintain their testing and contact tracing regimes? Will they maintain screening for international travel? Will they maintain certain kinds of social distancing measures for private events or testing requirements? Or will they just go back to doing anything? Also, a question is whether those baseline measures will have established sort of escalation strategies that as new waves or new variants emerge, we may see an uptick again of different kinds of response measures. For example, this week, Austria has re-put in place its mandate for indoor mask wearing, which had taken off a few weeks ago, but now it's put back on. So going forward, the data collection will be offering us insights into both this new baseline and also the different kinds of escalation strategies we see. So as we look to the next half of this year into the next, that's going to be the key questions in our minds. But also, of course, we're now more and more interested as a project and as a world in how we build greater resilience to this pandemic and to pandemics to come. And obviously, this data resource is one piece of that, is helping researchers understand better what different factors matter. For example, Anna mentioned how trust can be an important line of defense by decreasing people's fatigue and increasing their compliance with certain measures. How do we build that as a part of our broader armory of resilience going forward? But one other thing we'd like to work on as a project is thinking about the data ecosystem that's part of our resilience. So during the last 2 years, the world saw a really organic and in some ways very inspirational emergence of different kinds of data tracking projects, from cases, epidemiological data, virological data, behavioral data, all the kinds of information sources that give us a sense of how the pandemic is developing and how responses to it are interacting with that development. But that emerged in kind of an organic and unplanned way. And so as we look forward to the next one, how can we build a better data ecosystem that will help us see pandemics coming and also gauge their spread in real time and inform and empower governments to put in place the best possible responses? That's going to be important area of work going forward. For the last part of our presentation, let me turn to my colleague Toby, who will say a bit more about how this all works, how the project itself functions, and where the information comes from.
Thanks, Tom. So there's two big parts of our organization, how we do it. There's the people, and then there's the system, the back-end system. And the real engine of the project is our people. It's our volunteer data collectors. So it's a citizen science project, really at its heart. And at any given time, we have over 200 trained volunteer data collectors that are looking at the policies in place around the world and entering that data into the back end of our database. And over the course of the project, we've had over 1,200 people contribute to this tracker. So, you can think back at the start of the presentation, Tom mentioned the beginnings of this project was just half a dozen students and staff at the Blavatnik school in a seminar room. And from then we've had over 1,200 people contribute. And in fact, many of the people you've heard from today, so Helen, Caitlin, Maria and Hal, all started with our project as volunteer data collectors and then got more involved and joined our team eventually. And we've had people contribute data from all corners of the world and all walks of life. We've had doctors submitting their data from hospital hallways, and we've had grad students who are on holidays submitting data from a boat in the Pacific Ocean. I kind of call this the engine or the heart of the project because that human judgment is so important. Tom kind of just mentioned just now the idea of this data ecosystem, and we do quite a bit of work talking to other people that are part of the data ecosystem around COVID. And a lot of people, particularly more on the data and techie side, say, look, can't we automate this? Can't we use some kind of AI system to crawl the web and collect policy data? And the fact is you can't. At the moment, there's just no substitute for the human judgment required to interpret policy and quite complex policy decisions. So we owe a great deal of thanks to all of our volunteers around the world. And if we flick over to the next slide, I'll just talk about the other big operational plank of our project, which is this kind of custom system that we've built and sort of cobbled together as we go. We have a sort of custom data entry portal connected to our database where our volunteers enter data according to the code book. And in our team, we've used the phrase that we're building this plane as we fly it, because we're constantly working to keep up with the moving frontier of pandemic policy. Helen described this a little bit when she was talking about the recent vaccine data that we've added. And the chart on this slide gives a pretty good example. So it shows what proportion of countries have had school closures or mask mandates over the course of 2020, so the first year of the pandemic. And you can see in the early days of COVID-19, basically every country closed their schools. This goes back to the very first graph that Anna showed. And so it was very clear to us in the early days of our project that school closures were a big deal. When we launched the project, we only had 7 indicators. School closures was number 1. But at that point in time, virtually no countries had mask mandates. It just wasn't on our radar. By mid-2020, it was pretty obvious that a lot of countries had mask mandates, and we realized it probably should be on our radar. But it took us, another 5 months. It wasn't until October 2020 that we actually could publish mask data. And that's because we had to spend, a whole bunch of time collecting 6 months worth of data to have the full set. Now we're at this point with our system where to publish new indicators, we have to cover 2 years of previous data. It's like 300,000 data points. And we're doing this at the moment with vaccine indicators, as Helen said. But the system is started off as it was just kind of half a dozen students entering data into Google Sheets. Then it became an aeroplane that we were building. And now the system probably feels more like an ocean liner, something with a lot of inertia, takes a long time to steer. But it's an ocean liner that I think we're all very proud of and excited to keep building. So with that, I'll pass back to Tom.
We are indeed excited to keep building it and certainly planning to keep moving it forward as we are able to provide value to researchers, to governments, and to the public in terms of measuring this. We have a few questions coming into the chat, and I encourage everyone to please go ahead and type your thoughts and questions into the chat box, the Q&A box, so that we can take them going forward, and ask everyone on the panel to come back on, and I can pass out some questions to everyone. So we can turn off the screen and get everyone back up here. Wonderful. So the first question, the first two questions actually are quite similar, and I wonder if I can ask them to you, Helen, because Helen is the data manager for the project. So Felipe asks, relying on coders is what makes it all possible. However, how do you ensure reliability between coders within and between countries? And similarly, Letitia asks, how do you train volunteers in data collection? So Helen, could you give us a bit more insight into the training process and how we ensure comparability and consistency?
Yeah, absolutely. Thank you, Tom. And thank you both for the great questions. It's always interesting to kind of share a bit more about how it works behind the scenes, rather than just kind of showing the nice graphs and the data and then forgetting where it actually comes from, which is hundreds of volunteers sat at their desks around the world doing this around their 9 to 5, or they're studying, or their lectures, which we always find really humbling to see. So I'll start with the training. So my colleague Emily has designed a bespoke e-learning training course, which the volunteers complete as part of their onboarding process. So this is completely custom built from all of us in the team, and it ensures that they go through every single stage of understanding what the different indicators are and how we interpret them, and really common errors that we've been seeing, to make sure that they all understand what's being asked of them and how to enter the data. And then as part of their onboarding, we make sure that they have the opportunity to attend coding clinics in the first few weeks of being part of the project. And we provide really detailed email feedback to them in their first few weeks, and every week going forward if we need to, just to make sure that there's a really clear line of communication and loads of opportunities for discussion. We have weekly check-in calls with our volunteers, which are a really nice chance to just get to know them a bit better and discuss what we've seen that week and issues that have come up in the last round of data collection. And that's really our forum for discussing really complicated issues and standardizing interpretation across the team. And we were finding in those calls very early on that similar questions were coming up regularly. For example, asking if one workplace is closed, do we record that as like a 1 or a 2 for our workplace closures indicators, or does it have to be 3 different workplaces closed, different things like that. So we created an interpretation guide which lives on GitHub as part of our GitHub documentation, and that standardizes the outcomes of all of these discussions, both on email and in calls with our data collectors, to make sure that every single data collector, both for the national team and all the subnational teams, have access to this document to standardize those nuances and those interpretation points, and make sure that everyone has access to the same information. We also have intercoder validation checks. So we'll ask different coders to collect a data point from a point in time, and we'll compare it to one that another one did, to see that everyone's kind of interpreting different policies in the same way, or the same policies in different ways. And that gives us a sense of where we need to focus our training more, focus our communications more, and a sense of how standardized the data collection is. And the results are really good, so we can kind of rest assured that they are interpreting the policies in the way that we kind of would expect them to. And then finally, I've kind of touched on it already, we asked the data collectors to submit their kind of update tasks, so adding information to the database every single week. And every single week we go through a really thorough review process, both at the national level and all the subnational team level. So checking every single entry manually, with a member of our project team's kind of experience looking at it, checking that the data makes sense, there's a good note, the policy has been interpreted through the codebook in the right way. So that's kind of our chance to see it. And we'll either provide direct feedback to coders at the time, or we'll raise it in a call, or we'll flag it with our really experienced review team. So they're coders who have been with us for several months. They're really meticulous, they're really precise, and they review the data every single week. So they'll go in, double check it, and then confirm it. So there's lots of different ways that we kind of keep oversight of the data. Hopefully that's a snapshot into a few of them. And I'll hand back to Tom.
Thank you, Helen, for giving us that overview of how it all works. And indeed, the data comparability is a huge focus of our efforts, as Helen has described. Question from Letitia on, are there differences between the mitigator and eliminator countries in terms of outcomes such as morality? And she also asks, do you also track economic recovery in the relationship with stringency measures? And this is indeed, two really important questions, Letitia, that many people have been asking and investigating using our data over the past 2 years. We've been looking at that, but also other projects that are using our data, which is the whole idea. I'll put a link into the chat for some a short snapshot research note we put out today, which just kind of summarizes some of the macro patterns on both the impact of the disease and the impact on the economy. And what we see is, many, there's now, I think, very strong evidence across the world that basically acting more quickly is a way to minimize health impacts and also keep the economy more open and more in shape. And that some of the worst outcomes are observed where you sort of wait too long and then have no choice but to use a long period of very stringent restrictions in order to minimize the health impact, which then has, of course, a big impact on the economy. So these are less. If you look at some of the graphs there, you'll show some of the countries are doing very well at getting low health impacts with low economic impacts, and others are kind of scoring badly on both those dimensions. Also regional variation here, of course. So in East Asia, we've seen a number of countries which have been able to maintain elimination strategies for a very long period of time and therefore have good economic outcomes and good health outcomes. Lots of countries, for example, in Latin America, were much less successful on both those dimensions. But of course, one of the key things is that can really change. So now we're seeing a number of countries moving away from their zero COVID policies or beginning to question whether they can maintain them, and therefore seeing some really big health effects. And we've seen pretty clearly, you contrast what's happening in New Zealand, which has had a lot of cases as it's opened up, but very few deaths because of its high vaccination status, to Hong Kong, which has also been very successful in the past few years in maintaining low impacts, but has unfortunately been less effective in vaccinating elderly people, means that change is very different and there's a much higher death rate for people there. The third question from Letitia on how we deal with confounders that are inevitable in an ecological study, such as the COVID-19 tracker. I wonder if Anna might refer this one to you to say a little bit more about how we kind of use this data to investigate these big trends across countries when there's obviously so many different things going on.
Oh, that's a big question. Yes, so there are a lot of different confounders we've had to think about. And it really, to some extent, just depends a little bit on the question we're trying to ask with the data. So to go back to some of the patterns that I showed before about observance of different protective behaviors over time. And if you like, how willing or unwilling people were to go out, one of the big confounders we had to think about in our statistical modeling was actually the weather. And this was a really important one, it turned out, in predicting, in particular, the Northern Hemisphere countries, whether people wanted to go out in the sunshine or not. So it's always difficult when dealing with observational data, and that's what we have when we have case rates and death rates, and even our policy data as well, to think about all the various confounders. But I guess the way we do it is just to brainstorm and look for reliable data to control for these confounders, and then run an awful lot of different robustness checks on our key findings. Unfortunately, we can't rerun a parallel universe, if you like, and have a perfect experiment to take some things in and some things out to see what would have happened with and without certain policies, but we do the best we can. Thank you, Tom.
Thanks, Anna. I wonder if you might just also address Christian's question on the potential relationship between interpersonal trust and policy stringency. So we show that lower interpersonal trust was less linked to more to less social distancing, I think that I should say. But does it also correspond to policy stringency in some way? In other words, is it trust that causes government policies to be certain ways, or is it actually trust mediating government policies?
Oh gosh, that's another hard question. So I don't recall us actually finding any strong patterns in the different forms of trust and the level of policies that were brought in that might not be explained by other things. But what we were really looking for was how willing people were to keep up with behaviours that the policies were trying to encourage. And so to sort of answer that question by sort of taking our findings further, if you like, one could imagine that if citizens are behaving in a way to protect themselves better over time for any given level of policy, then you're going to have a lesser infection rate in the country, which logically, should all things equal, suggest that you're not going to require stronger policies going forward to contain a community transmission. So I think that's the fullest answer that I can give without running more regressions. I hope that gives you some answer to your question.
Thanks, Anna. I might just add a descriptive finding, which I think is very striking and really motivates a lot of the value for the research in this question. If you look at the countries in the top quartile of interpersonal trust, so countries that people most trust other people, you see, and you compare this to the countries in the bottom quartile of interpersonal trust, you see two really interesting outcomes. First, the high trust countries, high interpersonal trust countries, have about 30% less time spent at a very high level of stringent restrictions than the countries in the bottom quartile. So you see less restrictive measures in those places on average and for shorter periods of time. But if you compare the health outcomes, the countries in the highest quartile of interpersonal trust have about half the deaths over the 2-year period as the ones in the bottom quartile. So interesting to see a very different level of policy in both places and also some interesting health effects. Interesting, though, that's different from trust in government. So trust in government, countries with high trust in government also have better health outcomes, but they don't have any significant difference in the level of stringency of their policies. So there does seem to be something about interpersonal trust as a particularly effective way of getting more health benefit for less disruption, if you will. But those are obviously just average statistical descriptive statistics, so lots more needed to dig into those questions. Wonderful. Question from Chinyu Wang, which is about if the project wants to fit into different COVID situations and changes direction, what's the most ideal direction you want to research? Which is a very open-ended question, Chinyu, and thank you for it. I'd be curious to see if anyone on the team has an idea here, but I guess my own view would be we really need to be looking at how the changes that have happened over the past few years, whether or not they lead to any kind of systematic changes in how governments approach pandemic preparedness going forward. So we had a lot of information around what the government should be doing for pandemics in reports, in expert panels, in all sorts of government publications sitting on people's shelves in the years before this pandemic. But now we've had a lived experience of it across the world that's really quite unique. And I'd be very curious to see, Chinyu, what we see sticking and what doesn't stick and how that may affect our preparedness going forward. During the first months of the pandemic, there was an observation that countries that had had previous similar types of situations, for example, on SARS or MERS or Ebola, had had better responses than some of the countries that hadn't had that prior experience. I think the numbers have now changed a little bit around that. It's sort of hard to show a very clear pattern there over time, but it does, I think, raise a really interesting question of how we might be able to build greater resilience going forward. So that's one that I'd put high on the list. Does anyone else on the team want to offer a thought on your most ideal direction for future research? Anna.
So the list is way too long. I think I have a spreadsheet of brainstorming with other team members. I think a very discrete question that's very important right now, though, is to understand a bit more the effects of vaccine mandates around the world and to look at what's really going on in countries when there's a big gap between the policies that people who are vaccinated have to observe and the policies that people who are unvaccinated have to observe, because we've seen extraordinary responses, protests and so on. And I'm really eager to see what we can actually learn when we start to analyse our data with different forms of data to understand the effects of all these things. Thanks,
Anna. Great set of questions to be looking at. So I think we've come toward the end of our questions, which means we can begin to draw things to a close. But let me just end by saying a few words about the people who have really made this project possible over the past 2 years, who are primarily, as Toby said, are volunteer contributors, the 1,200 people who have given their time and energy to do something rather abstract. And I think a lot of people ask us, well, why, how does this all work? How do you get people to do this? How does it work? To create a research grade database. And it's really a shared purpose, a desire people have to contribute to something that's creating a global public good that has been allowed us to do what we've been wanting to do. So scientific aptitude, resources, all those things are important, but actually it's the willingness of people to work together that's really at the heart of this project. I think that's an important lesson for me as an academic, but I think also for the world as we think about how we build our way out of this pandemic and the future ones, for a very vital resource that we shouldn't underestimate. So huge thanks to our volunteers for all they've done, and of course the team for doing that, and of course also to the Blavatnik School events team for putting together this webinar, and to all of you for joining today. Thank you for your time. We'll look forward to looking back in the future on what more we learn as this project goes forward. Have a good day, everyone.